So let's talk today about what causes a heart attack, because there's a huge myth out there that it has to do with cholesterol. And I'm going to tell you it has nothing to do with clogged arteries or anything like that. So a heart attack is essentially this. Every cell of your body needs oxygen to create energy. And when your heart, you have these coronary arteries which supply oxygen to all of the surrounding heart tissues. And if they get blocked, what happens is not enough oxygen gets to the heart cells. And because of that, they can't produce energy and the heart dies. Okay? What I want to show you today is that it has nothing to do with your cholesterol levels, or actually a blocked coronary artery for that matter. Okay? The common theory is this: you have cholesterol which comes in and clogs your arteries, and it restricts the amount of blood flow, and that makes sense to people. There was a study done, I believe it was in Germany, by this doctor who took a dog and he tied up one of the coronary arteries, gave it 100% occlusion, right? And said, okay, let's see how long this dog survives for. Bring the dog back, from his sedation, no problem at all. Dog lives, no problem. So he puts him under again, does it to the second coronary artery, brings him back from sedation. Again, the dog is totally fine, no problems. Finally goes under, puts all of his coronary arteries under, all tied off, so all three coronary arteries completely closed off. Bring him back, dog's still alive, no heart attack. How does that happen? Well, it has to do with this. Your body has something called collateral blood creation, or collateral blood flow, meaning if my coronary artery is blocked, my body's really intelligent, it'll create new blood vessels around it. Okay? And anyone who's ever died of a heart attack, they can actually do studies of the flow of blood. And what they typically find is there's no reduction of blood flow to the heart tissue when someone dies. So what's causing a heart attack then? Turns out we're looking at the completely wrong system. What we're doing is we're focusing on the blood system, and it has nothing to do with that. It actually has to do with the nervous system. What they find in people who have heart attacks is that, when you see something that startles you, your heart kind of picks up and you have that rapid heartbeat. That's called your fight or flight response, or your sympathetic nervous system. What they find with people is that they have this fight or flight response, but for some reason their nerve to turn that off isn't working, so they can't slow their heart down again. So what you're left with is a heart that speeds up, it goes really fast, they can't slow it down, the heart burns through all of its energy, and there's not enough oxygen left to give fuel to the heart, and then it dies. So the real trick then is not looking at the blood system, it's actually looking at the nervous system. At the top bone of your neck, you have something called your vagus nerve that comes down, and it's what slows the heart down. Okay? When the top bone of your neck is misaligned, a lot of times it'll create it active. The other thing that'll happen is it'll throw your head forward, and it starts to put stress on your lower spinal cord, and as a result, it kind of puts your heart in that sympathetic fast beat state. So the real answer to this is actually getting the top bone of your neck adjusted, put it back in place, practice meditation, there's something called peak 8 exercises, or high intensity interval training, which will work on your heart speeding up and then slowing down. So you really want to do a couple things to work on your heart getting fast, and then work on it slowing down again. Hope this helps. Bye.